and maybe some psychotherapy sometimes, and then we send them back home to the community. And as Edna was saying, and also Korir presented, we have a new guest. So we need to be involved with the community, within the community. I think as our presenter from Nakada spoke, we need to go extra mile. We need to go extra mile when now we meet this patient in their community. And some of these patients maybe even do better when we treat them as outpatient in their community. So I was privileged enough this year to visit the University of Maryland, Baltimore, University of Maryland Medical Center. That's where I was, but in Baltimore. And they have a program called PACT, which is Program Assertive Community Treatment or Therapy. Okay, it's a program that intends to treat patients in their community. So I'm sorry for confidentiality issues, for many legal things. You're not allowed to take photos. Yeah, you're not allowed to take photos of anyone. If someone sees you taking a photo, it's a problem. Yeah. So I don't have photos of me doing those programs, going around seeing patients in their homes, in their community because of legal issues. So probably for me, it won't be a problem, but for the program itself. So I don't have really pictures of what we were doing. So that's the University of Maryland Medical Center. I stayed there for a month. And then one of the programs that we were doing was this PACT, Programs Assertive Community Treatment. And in that program, maybe I skipped that because of time, they help patients, okay? Their primary goal is to help patients and their loved ones, okay? Patients who have mental illness, and then they provide resources that are very important for their full recovery and treatment. So this is the place where I was in Maryland. These photos, I took them from online because I was afraid of taking photos and being sued. Yeah, but this is the same place where I was. Okay, so as you can see, this is a real situation. I can remember these places. It is called the Southwest of Baltimore. It's one of the poor area of Maryland. Okay, we populated with mostly black Africans or black Americans and Hispanic. Okay, uh, most of the people you hear have a lot of mental issues, and because of drugs, substance abuse. Okay, and our role with the mental team, the PACT team, we were doing what we call we're treating patients from home. Okay, no one comes to the hospital. Okay, it is us who are going to see the patient from home. So the PAC team was made of counselors, social workers, job coaches, psychiatrists who were there at the center, psychiatric nurse, substance abuse specialist, and the consumer advocate. For as much as this presentation is concerned, I'm just want to emphasize on the job coaches, okay, because that is very important. So the PACT services that they provide, it is mental health assessment and treatment, psychiatric rehabilitation, continuous care, 24 on-call coverage, medication evaluation, prescription and monitoring, and then the last one, assistance with entitlement, representative of pay service, assistance in securing houses and jobs. You see, it's a continuum, it's a cycle. So because I'm just going to emphasize on the last one. We were visiting patients from home, from our unit, and going from our unit to their places. We divided ourselves into like 7 teams. Okay, resources were available. Every team had their own car, and like going as either you are going as a social worker and a doctor, depending on the patient you are going to see, the need of the patient. Okay, we go to see them. If they needed a medication, we go with their medication. Even if it is injection, we were injecting them from home. Okay, we take the medication where they are, we treat them where they are, we do their counseling from home, and then we go back. So one of the things that I enjoyed very much was going with the patient, picking the patient from home, taking them to their job place. Okay, it is the responsibility of this unit, the PACT team, okay, to help the patient get a job. We go, we look for a place where we can, they could put this patient. They know they have that mandate by the government, and they go discuss with people who are responsive to the needs of the people, because not everyone is open to do that. And then once the patient is accepted, they coach the patient, they follow the patient so that he maintains the job, okay, that he got or she got, okay. Follow him or her up to find out if he or she is able to secure the job. For people, for some reason, who are unable to secure the job, okay, we were looking for, trying to help them to get another job. And some of those jobs were simple, like cleaning or working in a grocery and arranging things, okay, or just cleaning, or just be the person who orient other people, like come in, welcome, something like that, something like simple. But some people who were already very stable, okay, were even occupying some job that required a lot of mental involvement. So we had so many success stories of people who were abusing substance, but who had been cleared from our mental health unit and who had normal life. The beauty of this program is that even it was the responsibility of this PAC team to help the patient secure a house, helping the patient getting a house, okay? For those who need, for example, who are under the government support, the PAC team will receive the money from the government, and then they help the patient manage the resources, okay? They help with the patient, they coach him or her how to use the money, or how to use, not to spend money on unnecessary things. So why in our area are we not even able to do that? Yes, this program required a lot of resources. This program required a lot of resources because you need multiple people, multiple teams, vehicles, because we were leaving the unit from 8, we come back around 4 p.m. sometimes, okay, and when we get out, we only visit 2 or 3 people, and we had a schedule, and every patient was visited at least twice a week. Every patient twice a week, okay. That's a patient who is stable, okay. If you are unstable, they can visit you every day, and whenever you call, you say you are not feeling well, there is a team that is ready to come to see you. Yeah, that means it requires a lot of resources, okay. Visiting someone twice a week, it's very expensive, and there are so many things that comes around, like roads in our area. Trying to see how will you visit someone who you are here and then go to, I don't know, somewhere that you go 4 hours on a rough road, okay. It's difficult. But when I came back, I realized that we may not have the same resources, but there is something we can do. One thing that you can do is that we all have mental patients. They come to see us probably once, and then all 1 month we don't have any contact with the patient. We don't know what is happening in the community. We don't know what even the medication we have given them, the kind of substance, the side effects that they are having, because we told them you will come back after on this date. The patient, the family members, they really respect the timing unless the patient is dying. Otherwise, they will come that same date, even the patient is not doing that much well. So there's something that we can do. We may not visit the patient every time that we need, but we may call them. We may call. These days, even the list of the nearby, there will be someone who has not a smartphone, but a phone, okay, which you can access. You can call the patient and find out how they are doing, okay. That's how you know that you can call the patient to come back, or that's how you know even that you need to do a home visit, okay, which something that I congratulate this hospital, that it allows the mental health team to go and do home visits, okay. Yes, whenever we say we have patient that we want to go to do home visits, okay, the vehicle is provided and a team is dispatched. So what are you doing in your community? Are you following up your patients? Do you have phones of your patients? Do you have family members' phones? Because this has only this system, as much as it seems like it's a lot of money that this government has invested, okay, but it reduced significantly the budget that they were using to treat all these patients from inpatient when they were not doing well. One of these patients get admitted, okay, and get multiple teams seeing them, a lot of things happening in the hospital, okay. So the government invested in this and reduced significantly the money that we were spending. Short term, you invest a lot of money, but the outcome is greater because your patient become controlled and is accepted in the community, okay. How are we helping our patient to get jobs? Do we even think that they can do jobs, or we think that is a lost case? Do we think that our patient, it's our responsibility to help them? Or we think our responsibility is just to administer drugs. Whether they do better or not, it's not our business as long as we have given medication. This thing that we are doing requires us to go an extra mile. It requires you to be innovative, to do something that has never been done, to do something that the community thinks cannot be done. Remember, it requires also you to put yourself on a spot. When you take someone to, for example, hire gift mat and say, I have this patient who is mentally ill, okay, the first thing they will say, mentally ill. Yeah. So, and then you say, can we help this patient to get a job here? You know, there are some people who are mentally ill because they don't even have jobs. Yeah. So when we have, remember what Dr. Mugira said, there are things that perpetuate, okay, the symptoms. There are things that precipitate, you know, all those things sometimes will just require to use this fifth, the last thing, the assistance in getting people's job, helping people get house where they live. We may not build a house, but we may be involved in the community, telling the chief, the community around, that this patient needs where to stay, because you understand it. You understand that this may be the one thing that is needed for this patient to be better. So we may not do everything, but we may be the initiators, okay, for others to follow. So I'm going to challenge you from today, all of us here, okay? When we think about this patient, let us not see them every month. We may see them maybe every week or every 2 weeks by just calling them, finding out how they are doing, finding out how their medication is doing on them, okay? finding out how their families are taking care of them. There are people. There's a patient who was brought into this facility after spending how many months on a chain? Joshua. Yeah. Eh? So you may not know that if you don't visit them, yeah, or if you don't call them. So my challenge when I came back from this, we always cry that we don't have enough resources. But even what we have, we are not using it. We have phones, so use your phones to do follow-up. Because this team is doing 24-hour call. And for example, all the units, you may have phones for the units. Okay? And you have numbers of the family members or the patient. Talking to them also is therapy. It's therapy to the patient. It's also therapy to the family because they know that they are not in alone. They know that you are supporting them and that you want to know how the patient is doing, that they have your back. You are backing up them. Okay? They have your back, or you are having their back. Something. Yeah? So please. And then second, how can you help this patient reintegrate the community? If are you able to support them, to advocate for them to get jobs? Because no one is willing to give them jobs. Some of the jobs may be something small. If it's someone who can clean, is he able to clean and you give them something small? Is you may be even the first person to start to trust them that they can, okay, that they can do something in your shamba, okay, that they can do wanaweza kalima in your shamba and then they get something to eat, that they can kata mti. It doesn't have to be something big. You have to start to get something small. Security first, yes, something that will not harm them, okay, something that they can do that feel, oh, I can do this and I can be paid. I can do this and I can get something. I can do this, I eat. Start gaining their trust and their self-esteem that they are not the outcast of the community. If this team, you can read about the team. Okay, you can read about the PACT team. It is online. PACT team, University, UMMC. You will see all these things, how they work. And there are so many reports on how they were able to reduce the spending because of how they are doing. So, because of time, my challenge to you, we need to move from hospital, yes, to community. We need to move. We need to be like pastors. Okay, we need to move from churches and go to look for new believers in the community. And for us, we need to move from treating patients when they come to see us, but treating them from the community and seeing them from home. Okay. Any question to all these things that Dennis presented and Edna presented, or any comment, because this is not even it's comment, or how have you been doing this? How have you been doing this? The people who have been working in with a center, okay, outpatient, how are you dealing with your patient? How are you helping your patient get jobs? How are you helping your patient get reintegrated to the community? Or how are you following up your patient?
Okay, we found when I was just sharing with her, and I was showing her some photos that have been sent by our social worker today when they went for home visits and community service. We do that to reduce the cost at Chokori Hospital. I might see a patient and then I refer this patient might need to be seen by uh, maybe a nutritionist, or maybe they need to go to the oncology clinic. So how we reduce the cost? maybe I need to do home visits. What I do is I'll pick the number of my patients, the ones I need to visit, and then I will ask the nutritionist if she also has patients whom she needs to visit, and maybe the person also managing the oncology clinic, or maybe any other clinic, and then we combine. Because the hospital does very good to provide transport, and that one, of course, you have to plan prior so that they organize, and they will never deny you. So we combine in order to cut costs. Instead of the social worker going to visit, then also go visit the following day, and then maybe in the oncology clinic, nutrition, we just work as a team, and then we combine, and maybe within one day, if you know you have many patients, you leave very early, and you'll come back very late.
Thank you so much for sharing.
Yes, you call.
You call. Good. Tell us more about it.
For our psychology department, we have not been privileged enough to go for home visits, but what we do follow up via phone call, and most of the time those will be for phone sessions. So you get to know whether the patient has a challenge. Like now, if I can use an example of one that we realized is having a challenge. So the palliative department is one which does more home visits. So we have linked them up so they may get our home visits from the palliative department.
Okay.
We are together, but we've also integrated them in the community by helping them to make like these soaps, and then we get them sent to the staff in the community around, so they are able to answer.
How was the acceptance by the community? How is the acceptance by the community?
Right now it's okay.
How was it at the beginning?
Because they were interested to start. Yeah.
How did you overcome that?
We went to the community and we started, sensitizing that, these are people that can live with us, and there are things that they can do which we can embrace, and we support them, and we live together.
You see, we have a role. Thank you for sharing. We are the key figure in how to do these things.
Thank you so much. In Finland, in our mental health department, we normally see clients and support clients, and normally we normally do a follow-up since they are confined in one place, and we as counselors, we normally go and visit them, and especially maybe when they have challenges or family issues, maybe they have other challenges, and also the company has a program of empowering those people also in financial management. They take them through some trainings, and finally you find them, they can do some side hustles apart from the work that they are doing. So they are being empowered in all ways and several ways. And we have also the social workers, we have the clinician team, and we have also the management. Right from top to down, we have management and all the support. And whenever you support these people, they will be back and appreciate a lot. And I just want to say that we are the ambassadors, and this is a ministry by its own. So even as we do this one, let us do it as serving Christ through these people. I normally thank God for these people. I normally thank God for every person who is coming to my life, because it is an opportunity to serve God through that person. It is a calling, and we do it diligently as we serve Christ. Thank you.
Thank you. Thank you so much.